Order. End of question time. Ministerial statement. Minister for Health.
Mr. Speaker, sir, thank you for allowing me to make a statement on the unauthorized possession and disclosure of information from HIV Registry and to respond to the various PQs asked earlier. Senior Minister of State Gan Kim Yong will speak after me on matters regarding governance on data in general. So on 22nd January 2019, the Ministry of Health was alerted to a case of unauthorized possession and wrongful online disclosure of information from the HIV Registry by one Mikhy Farrera Brochez, affecting 14,200 individuals diagnosed with HIV and 2,400 of their contacts. The incident has caused anxiety and distress to the affected persons. This matter is especially delicate as it involves persons living with HIV. Our priority is their well-being. Members have asked several questions regarding the incident, so let me first give a brief account on what happened, the actions we took, and why. Some have asked whether MOH had known about Brochez's possible access to HIV registry information in 2012 when he first made a complaint to MOH. Let me clarify that the issue then was not about Brochez access to HIV registry information, but a different one. Brochez was then a partner of Dr. Walter Theseira, who was then the head of the National Public Health Unit, and they had lived together. In November 2012, Brochez alleged that Le had disclosed information about Brochez to others. He later also claimed that Le had shared screenshots of his HIV status with others. Despite multiple attempts by MOH to engage him, Brochez did not provide any evidence to support his allegation. He was uncooperative and evasive and rejected or postponed meetings with MOH on several occasions. At one point, he even informed MOH officers that he was leaving Singapore and did not want to continue with the investigation into his allegation. Due to his uncooperative attitude, the investigation could not make much headway. Nevertheless, we reassigned Le to another role in May 2013 and kept up the investigation. Le's access to the live HIV registry was terminated after his reassignment. In the course of our investigation, MOH discovered in December 2013 that Brochez may have submitted the fake HIV blood test to MOM in order to retain his employment pass. We informed MOM and also made a police report. Le resigned the following month. MOH investigations in 2012 and 2013 were on Brochet's allegation that Le had revealed Brochet's HIV status to others. At no point in 2012 or 2013 did MOH have basis to suspect that Brochez had access to or was in possession of the data in the HIV registry. Between 2014 and 2016, police and MOH investigated whether Brochez had submitted fake blood tests and whether Le had abetted this process and provided false information to investigators. These investigations were difficult, as Brochez continued to be uncooperative and initially refused to provide a statement to the police. The police eventually recorded a statement from Brochez in May 2014 after he was stopped trying to leave Singapore. When interviewed, Brochez lied to the police that it was his blood that was tested during a HIV test conducted in November 2013. MOH then ordered Brochez to undergo a fresh blood test for HIV to verify his claim, but Brochez refused to cooperate. In late April 2016, Brochez was arrested for repeatedly refusing to comply with MOH's order to take a blood test. He then provided the police and the government authorities 75 names and particulars from the HIV registry. This was the first time the MOH had evidence that Brochez may have access to HIV-related data. We made a police report on 16 May 2016. The police raided Le's and Brochet's premises simultaneously. and seized and secured all relevant materials. These included their computers and electronic storage devices containing files with confidential information from the HIV registry, files related to hospital services and other infectious diseases, as well as other information likely used by Le for his work, such as emails, HIV studies, and reports. The police searched through Brochez' email account and found that Brochez had sent the same screenshot that he had sent to government authorities, as well as a PDF file of a further 46 records from the HIV registry to his mother. The police then contacted Brochez' mother, who agreed to let the police access her email account and deleted those records. At this point, the police had seized everything they found in Le's and Brochez' possession and had done their best to ensure that no further confidential information remained with Le and Brochez, including in their known online accounts. It was always recognized that there was a risk that Brochez could have hidden away some more information. Unfortunately, as recent events showed, Brochez did manage to retain at least the data which he has recently disclosed, and we cannot rule out the possibility that he has more. Le and Brochez were both charged in court in June 2016. Le was charged for both under the Penal Code and OSA. Le's charge sheet, which was public information, stated that he had access to the HIV registry as part of his position as the head of MPHU in MOH, and that he had failed to take reasonable care of the information in the HIV registry by failing to retain possession of a thumb drive on which he had saved the HIV registry. Brochez was charged for offences under the Misuse of Drugs Act, Penal Code, and Infectious Diseases Act. AGC decides on the charges. AGC decided not to charge him under the OSA because they assessed that he would likely be sentenced to a fine only, or at most a few weeks in jail. This was because there had been no wide dissemination of the information at that stage, and he had primarily used the information to complain to government agencies, and he was already facing numerous fraud and drug-related charges, which carried far heavier penalties. AGC also assessed that any jail term under the OSA was likely to be concurrent with jail terms that he would serve under other offences. Brochez was therefore issued with a stern warning for the OSA offence. Brochez was subsequently convicted in March 2017 and sentenced to 28 months imprisonment. In its judgment, the court found that Brochez had deliberately flouted the law for personal benefit and that there was not a single word of regret. Mr. Speaker, sir, let me now address questions as to whether MOH should have informed the public earlier. In 2016, MOH had to decide whether to inform the affected persons and whether to make a public announcement about the incident. These were not straightforward decisions. On the one hand, there is the need to be transparent. On the other hand, we need to consider the impact of an announcement on the affected persons with HIV. Would it serve their interests or would it harm them instead? I discussed this with my medical colleagues in MOH. They emphasized the need to pay particular attention to the concerns and needs of HIV patients. Excuse me. A person's HIV status is a deeply emotional and personal matter. Some patients will experience high anxiety and distress from a disclosure or announcement. Some will feel compelled to reveal their HIV status to family members or friends. Relationships can be disrupted, lives can be changed. We had to exercise care and judgment in making our decision, and the well-being of the affected persons weighed heavily in our considerations. One key factor was that there was then still no evidence that the confidential information had been disseminated to the public. Brochez had sent the information to government authorities. The police search was extensive, and all relevant material found had been seized or deleted. While there could be no guarantee, MOH had good reason to believe that information had been secured and the risk of future exposure significantly mitigated. Ultimately, it was a judgment call to be made based on the information we had and the considerations for and against an announcement, and the assessed risk of future public exposure of the information. MOH judged that on balance, an announcement then would not serve the interest of the affected individuals when weighed against the inevitable anxiety and distress they would experience. 2 years later, in April 2018, Brochez was deported from Singapore after serving his sentence, and we had no reason, no basis to keep him here. In May 2018, after his deportation, Brochez sent a screenshot containing 31 records from the HIV Registry to several government authorities. All 31 records were not new. They were a subset of the 75 which Brochez had earlier reviewed to authorities in 2016. MOH lodged another police report. We considered again whether to inform the affected individuals and the public. The relevant factors were similar to those in 2016, but there was one difference. This time, we could not retrieve the screenshot of the 31 records in Brochez's possession because he was already out of Singapore. MOH therefore decided to contact the affected individuals and alert them to the matter. We did not make a public announcement as there was still no specific evidence that Brochez had more information beyond these 31 records. Furthermore, as on previous occasions, Brochez had only shared it with government authorities and not to any wider audience. A public announcement would create anxiety and distress, not just among the 31 persons, but also other HIV patients whose names were in the registry. In September 2018, Le was convicted for abetting Brochez to commit cheating and also of providing false information to the police and the MOH. He was sentenced to 24 months imprisonment, and Le has appealed, and this is scheduled to be heard in March 2019. Le's charge under the OSA is currently stood down. That means that the OSA charge has been put aside for the moment, but it remains before the courts and will be dealt with after proceedings on his other charges have concluded. AGC decided to go to trial against Le on the cheating and false information charges first, as they were more serious and carried stiffer penalties. The trial for his drug charges will be held next, as these also involve stiffer penalties, including mandatory caning. So that there is no doubt, let me say again that the OSA charge against Le is still live. AGC will decide on the OSA charge after proceedings on his other charges have concluded. This is the usual course. The most recent incident in January 19 stood on a different footing from earlier incidents. It showed that Brochez probably still possessed the entire HIV registry, beyond just the 31 records. He had also put the information online and provided the link to a non-government party. This new situation meant that the likelihood of the identities of affected persons being made public by Brochez had increased significantly. MOH therefore decided to make a public announcement on 28th January, even though we remain deeply concerned about the impact this would have on affected persons. We sought to quickly contact each of the affected individuals to inform them of the circumstances and also to offer them assistance prior to the announcement. We worked with the police and other relevant parties to disable access to the information as quickly as possible. Mr. Speaker, sir, at this point, let me reiterate the basis of our decisions and actions, especially on the issue of disclosure and announcements. At each juncture, May 2016, May 2018, and January 2019, MOH had to decide whether to inform the affected persons and make a public announcement. In making those decisions, MOH had a responsibility to balance the opposing considerations and exercise judgment on what would best serve the interests of the affected persons and the public. MOH made a judgment call, balancing the various considerations. It is arguable that MOH should have made a different call, but I reject any allegation that MOH sought to cover up the incident. On all three occasions, MOH's primary concern was the well-being of the persons on the HIV registry. Today, we still face the same dilemma as we did back in 2016 and 2018. We now know that Brochez retained some of the data after the police seized all the files they could find in 2016. Quite possibly, he still has more files in his possession. Should MOH now make known all that Brochez may or may not still have in his possession? Do we contact every person whose data may or may not be at risk, and in the process inflict more harm on people, even though it may ultimately turn out that Brochez in fact does not have the information? Again, we have to assess and make a judgment call. MOH has decided to continue to manage the situation in a way that reduces the possibility of further exposure. This is consistent with the decision taken in 2016 and again in 2018. It is based on what we believe to be the interest of the potentially affected persons. Mr. Speaker, sir, let me now turn to what else we are doing following the latest incident. Brochez is currently under police investigation for various offences. He is believed to be in the US. The police are engaging their American counterparts and are seeking their assistance in the investigations against Brochez. The police will spare no effort pursuing all avenues to bring Brochez to justice. Following our public announcement, a few parties have come forward to inform us that Brochez had in fact attempted to make contact with them in 2018 and had given them links to confidential information he had uploaded online. We have quickly worked with the authorities to similarly disable access to the online content. The content that was uploaded is similar to what we had found in January, so no new individuals have been exposed. We have also been working with relevant parties to scan the internet for indications of further sharing of the information. There have thus far been no signs of further disclosure, but we will continue to monitor. Should we detect any disclosure or online publication of the information, MOH will work with the relevant authorities and parties to take down the content and disable access to the data. Here I would like to remind everyone that the police will not hesitate to take stern action, including prosecution, against anyone who possesses, communicates or uses any of the confidential data that has been disclosed. The police will also not tolerate any harassment or intimidation of any form towards any person arising from this link. Stern action will be taken against perpetrators. Ministry of Health has prioritized informing and supporting the affected individuals. We have completed attempts to contact all the affected individuals, but we are unable to reach all of them, as many had dated contact information, given that the registry went back to 1985. Many of the foreigners were work-pass applicants who never worked in Singapore, or who previously worked here but are no longer in Singapore. Amongst the affected Singaporeans diagnosed with HIV and are still living, we have reached 2,400 out of 3,500. Individuals who worry that they may be affected or who have concerns can contact our hotline at 6325-9220. 6325-9220. We seek the understanding that to maintain confidentiality of the information, we have to verify the identity of the caller. Officers manning our hotline will then provide information on the incident and direct callers to available avenues for support. Ms. Anthea Ong, Associate Professor Theseira, and Associate Professor Daniel Goh asked about the measures taken to protect the psychological welfare of the affected individuals. We know that the affected persons may have concerns and may be worried about unfair treatment arising from this incident. Prior to calling patients, our medical social workers have helped to first identify those likely to require more support so that designated officers can exercise extra care and provide additional support when calling them. If callers request to speak to our counsellors, are in distress, or require more advice and support, counsellors are on standby to speak with them. Some affected individuals may prefer to discuss their concerns with those they are more familiar with, such as the medical social workers, nurses, and doctors who have been supporting their ongoing care and treatment. We have arranged with the relevant public hospitals to have medical social workers and doctors on site to attend to them. Agencies such as the Life Insurance Association, LIA, MOM, and TAFEP have provided public assurances on common concerns. MOM shared that Singapore has employment laws to protect employees from wrongful dismissal, including on grounds of HIV. LIA has in turn assured policyholders that insurers that receive information related to this incident will not use such information. They will inform the relevant authorities immediately. Understandably, despite these efforts, some will continue to be concerned. Some may decline to return to care because of the fear of future disclosure. Some felt we should have just informed the affected individuals. A few wished they had not been called at all. The anxiety and concerns which some individuals felt have also been carried in various online broadcasts and print articles in recent weeks. Our medical social workers were themselves distressed by the news they had to break and felt the anguish that the patients experienced when they were told. They had to conduct the calls carefully and gently and be alert to signs of distress so that they could help the patients appropriately. At times, our medical social workers became the target of anger and blame themselves. Nevertheless, they will do their best to support the affected persons. These reactions are not unexpected, and they were the reasons we made a judgment call in 2016 not to make a public announcement, and in 2018 to inform only the affected patients. Mr. Speaker, sir, members have asked about the purpose and safeguards of the HIV Registry. MOH National HIV Registry contains information of persons diagnosed with HIV in Singapore. We are not unique in having such a registry. Countries such as the United States and Canada also maintain HIV registries containing identifiable information. We need the registry to monitor the HIV infection situation, conduct contact tracing, and assess disease prevention and management measures. The data needs to be identifiable for purposes such as contact tracing to protect those who are contacts of HIV patients. The security safeguards for the HIV registry in 2012-2013 were in accordance with the prevailing government policies on classified information and IT security. Staff were briefed on the policies, systems and processes and regularly reminded of the sensitivity of the information which they should access on a need-to-know basis. All of them signed an undertaking to observe confidentiality obligations under the OSA. Prior to 2012, the HIV registry was placed in a secure network drive. The file could only be accessed and downloaded from government-issued computers and was password protected. MPHU staff will need to download the HIV registry in order to carry out routine data entry, contact tracing, and analysis. Staff were allowed to use personal thumb drives at that time, subject to adherence to data protection guidelines and policies. As the head of MPHU, Le had authority to access information in the HIV registry as required by his work. He is believed to have downloaded the HIV registry into a thumb drive and failed to retain possession of it. Le has been charged for mishandling the information. Mr. Seah Kian Peng asked about the additional measures undertaken to ensure data security. In 2012, prior to the complaint from Brochez, the registry database was migrated to a network-based system. MPHU staff no longer had to download the database file stored on the network drive to do their work. Instead, staff will call up records they require from the network-based system. With the implementation of a network-based registry, the audit trail was also enhanced. In 2014, alerts of multiple failed login attempts were incorporated into the system. MOH continues to follow the security policies from the Singapore Government Instruction Manual or the Security of Classified Information. In tandem with the government guidelines, we implemented several controls to tighten our systems. Specifically for MPHU, MOH's Chief Data Officer also conducted a data security review in 2016. Following the review, enhancements were made to further strengthen the NPHU systems. These include the following: elevating the approval authority for downloading and decrypting registry data to the level of the Director of our Communicable Diseases Division, or CDD, or higher. Implementing a two-person approval process to download and decrypt registry data to ensure that data could not be accessed by a single person. Designating a specific workstation for processing of sensitive data from the HIV registry. This workstation is configured and locked down to prevent unauthorized removal of data. In 2017, the MPHU also complied with government-wide policy to disable the use of unauthorized portable storage devices on official computers and only allow the use of authorized and encrypted thumb drives. To give greater attention to data usage and safeguards, we had also set up a data analytics group in April 2018. Within the group, a data governance division was set up to formulate policies, practices, and guidelines for MOH and its agencies. The aim is to protect and secure access to health sector data in accordance with data protection requirements in the Government Instruction Manual and PDPA and other MOH sectoral legislation. In light of the recent incident and the increased prevalence of data use across the healthcare sector, it is important to ensure that data security and governance policies are strictly adhered to on the ground. MOH will expand the role and resourcing of this unit. We will include within it a specific mandate and team to look into the compliance and audit of data access and use. Several members have called for destigmatization of HIV and asked how we can protect people living with HIV from discrimination. Stigmatization is an issue that all of us are concerned with. Destigmatization requires efforts across the society. Let me cite some of the efforts by MOH together with the government and non-government agencies, advocacy groups, as well as voluntary welfare organizations. Persons living with HIV require lifelong treatment. HIV therefore continues to be a serious infectious disease that MOH closely monitors and actively manages for public health reasons. But clinically, HIV treatment has vastly improved over the years, and early treatment can delay disease progression and improve the quality of life. Over the years, MOH has increased financial support and lowered the financial barriers for HIV treatment through Medisafe and Medifund. Since 2014, HIV antiretroviral drugs can be supported under the Medication Assistance Fund. MAF provides means-tested subsidies for lower and middle-income patients, covering up to 75% of the cost of antiretroviral treatment. In 2015, with the introduction of MediShield Life, persons living with HIV are now covered by our National Health Insurance Scheme should they be hospitalized. We have also made HIV testing and counseling services more widely available. For example, anonymous HIV testing is now available at 10 sites across the island. Special outreach efforts have also been made for specific groups. For instance, it is part of standard antenatal testing at our public hospitals. Support from doctors, medical social workers, and healthcare workers is also widely available in public hospitals. Generally, every HIV patient in public healthcare institutions is assigned to a medical social worker to provide assistance upon their diagnosis. So it is easy to stigmatize something that we do not understand. MOH has therefore been working with stakeholders to raise the awareness of the disease and reduce stigma for the disease. In 2017, SNEF TTSH, Tan Tock Seng Hospital, and the Health Promotion Board work together to introduce guidelines on managing HIV and AIDS in the workplace, to help companies create enabling workplace environments for employees with HIV. More recently, the tripartite guidelines for fair employment practices calls for employers to treat employees fairly and based on merit. This includes employees with HIV. MOH will continue to work with partner organizations to step up efforts in public education, stigma reduction, prevention, testing, treatment, and counseling support. But beyond this, how each of us as individuals relate to persons with HIV also matters a lot. Here I would like to appeal to Singaporeans to stand in support of these affected individuals and our efforts to fight the stigma against persons living with HIV. I would like to urge the public and media not to share illegally obtained information and inform the police or MOH immediately. The welfare of the affected individuals in this incident will be something of deep concern for us. We would like to encourage those with concerns to contact us at our hotline, again 6325-9220. You may also call the SOS, TAFAP, and Action for AIDS for approach the healthcare institutions and professionals that have been providing you care and support. Mr. Speaker, sir, this has been a regrettable incident caused by the irresponsible and deplorable actions of two individuals. Le is a Singaporean doctor and ex-MOH officer who had been entrusted with the care of our patients, but he had betrayed the trust of the ministry and the medical profession. I'm sorry that this irresponsible actions of one of our officers has resulted in such distress to the affected persons. Le's case is now before the courts, and he will be dealt with according to the law. The other, Brochez, is an American citizen who had left a trail of lies and deceit, and now perpetrated a reprehensible act that has affected thousands of persons with HIV. He had already spent time behind bars here for his earlier offences, and we will spare no effort in bringing him to justice again for his latest crime. As individuals and part of the larger Singaporean community, the best way for us to respond to this incident is with sensitivity, understanding, and support for those affected. If we can say no to discrimination and reduce the stigma surrounding HIV, we can turn the harm and discord that the perpetrators seek to sow into a more inclusive and supportive environment for persons with HIV. Thank you.
Mr. Speaker, Professor Walter Theseira had asked some questions about the standards for public disclosure of government information incidents involving personal data. Mr. Speaker, in the event of a suspected data breach, the first priority is to limit the potential harm to affected individuals. The agency involved will assess the damage, prevent further loss, and take precautionary measures to heighten safeguards. The Government Technology Agency, GovTech, will put other agencies across government on alert and also take broader measures if need be. A police report will be made if there is suspected foul play or the loss of physical equipments such as laptops. As to the issue of a broader public disclosure of the breach, this is taken as a considered decision, taking into account the possibility that such a disclosure may allow the attacker to create more damage, may help him cover his tracks, or may cause unnecessary distress. Thus, there's no standard timing for public disclosure that automatically applies to all data breach cases. Post-breach, the agency affected will undertake a comprehensive review of the incident to understand what could be done to prevent such an incident and what could be done better to manage the incident. Such a review would include the approach taken with respect to the decision to inform the public.
Associate Professor Walter Theseira.
Speaker, thank you. I will ask some questions of the Minister for Health first, I think. Minister for Health, at any of the decision junctures that you had to consider over the last few years regarding this case, did the Ministry ever consult any persons with HIV or HIV advocacy groups for their views on whether disclosure should happen, and if so, what views were expressed by these groups of persons? Second, in light of the move to destigmatize, the policy decision that HIV should be destigmatized in Singapore, and this should be reflected in employment and other areas of life, would it be appropriate to review, for example, immigration and employment regulations of foreigners regarding HIV as well at this juncture? Thank you.
Thank you. On the consultation with other organizations, as the member would appreciate, this is a very sensitive area, and we had information about Brochez and Le, and both of them were being charged in court, so therefore we did not consult outside parties. We were discussing within the ministry with people who have been dealing with HIV, persons living with HIV, including medical social workers and so on, so we were familiar with the concerns about the patients, and it was borne out with the issues that arose as a result of this disclosure, and it was therefore quite clear that the pressure and the distress and anxiety was real. And with regard to the destigmatization of HIV persons and whether we will review the immigration policies, we do these reviews quite regularly. Every time we look at what are the practice here and around the world, and to take into account the concerns, interests of our Singaporeans, and decide on these issues. And we have made adjustments along the way, as we have done so over the past few years. But as I explained, HIV remains a very serious infectious disease, and therefore we need to be very cautious in approaching this issue, and we want to make sure that we are able to manage the disease environment here and to protect Singaporeans where possible. And therefore for persons with long-term residence in Singapore, we still have a restriction on their access to Singapore. For persons who are short-term stay, I think the restriction has been lifted recently, and we are also not alone in this. I think Australia and New Zealand also have restrictions on long-term stay persons with HIV.
Associate Professor Daniel Goh.
Thank you, Minister. I have two questions. So the first one is, would those who are contacted by Brochez and do not report to MOH the correspondence and any leakage of confidential info, would the person be liable for prosecution? That means if the person is contacted by Brochez, given linkages, links online to confidential information that's leaked online, would the person be liable for prosecution if that person did not report to MOH that correspondence, that contact? The second question is, I'm assuming that the National Public Health Unit also kept lists of people living with other infectious diseases like STDs and TB. Were any of these lists also compromised by Le and Brochez? Thanks.
Let me answer the second question. Under the National Public Health Unit, they oversee public health issues, which will include infectious diseases, including MERS, bird flu, as well as TB, STD, as you mentioned, of course HIV. So the unit will handle many of these infectious diseases, and that is part of the information and data that the officers will be handling. And as to the data that has been exposed, it is limited to the HIV registry, as I mentioned. And the first question, whether a person receives information or link that is provided by Brochez, whether they are, it is illegal to retain them, I might have to consult my my colleague. But my suggestion is, whether it's legal or illegal, please forward it to us and for to the police so that we could follow up to investigate the implications of that.
Ms. Anthea Ong. Mr. Shanmugam, perhaps a response on point of law.
Technically, there could potentially be some offences under the Official Secrets Act, particularly if further action is taken upon receipt to, say, publicize it or send it to others. But as Minister said, if it is sent to MOH, I don't see that AGC taking action in those circumstances.
Ms. Anthea Ong.
Thank you, Mr. Speaker. I have two questions for the Minister of Health. The first one is, we are all aware of the painstaking efforts over many decades that have allowed people with, all suspect that they may have HIV to come forward for testing. So given this latest incident, what specific measures is the Ministry taking to make sure that these decades of efforts have not been negated? The second question is, given the requirement for long-term residency and HIV being an issue, which obviously created that whole fraud on the part of Brochez and Le, how many cases have we encountered so far where blood has been, fake blood has been used in order to get access to our long-term residence pass, or in the past even short-term? Thank you.
I stand corrected, but this is, in my memory, the first case that we have seen. But I will check and provide you with information. On the issue of HIV testing, and we do encourage persons who have a suspicion of themselves, who are uncertain whether they have HIV, to come forward to be tested, because we do have anonymous test sites across Singapore, and the identity of the person will be kept anonymous, and MOH will only receive an aggregated number of people who have tested and so on. We do not get the identity. So we'll continue to encourage you to come forward and to be tested, so at least you know your status. And we also encourage you to seek treatment. And of course, when you seek treatment, we will know who you are, because we need to provide treatment to the patients. And we will do our utmost to protect the data and the information as much as we can. And rest assured that we will do all we can to support. And of course, the Ministry will also continue to step our efforts in public education to reduce the stigma on HIV patients. At the same time, I think the effort is not just the government alone. I think the society as a whole should come together and show support for these persons with HIV, living with HIV. And by showing them support, I think we'll encourage more of them to come forward for testing, and more importantly, for treatment as well.
Mr. Chris D'Souza.
I thank the Minister for his statement. In the constituency I serve, there are persons with HIV. We work with them, we partner them. They are fellow Singaporeans. While I recognize that good work has already been done in this area by various organizations such as Action for AIDS or Catholic AIDS Response Effort, will the Ministry consider formalizing and bolstering this process, drawing from good initiatives in other countries? For example, Living Positive Victoria in Australia has a team of peer navigators who are themselves living with HIV, who work extensively with HIV patients and their families, one-on-one. Sir, some contract HIV through no fault of their own. These include babies. So, arising from this data leak, would the MOH consider a more formalized process of support for those living with HIV and their families?
Sir, I thank the member for his suggestion. Indeed, we will learn from many other countries, their experiences, and share their practices, how to better support persons living with HIV. And we also work with advocacy groups and support groups, as well as NGOs and voluntary welfare organizations, to see how we can enable them, how we can support them in much of the work that they do. Because as I mentioned, many of these require collaborative effort, not just on the government, but some persons with HIV will feel more comfortable with talking to people that they know, they are familiar with, and therefore it's not just the government doing it. We need to work with multiple agencies, whether it is Action for AIDS, whether it's SOS, whether it's other voluntary organizations. We try to work with them and see how we can best outreach to these people who need support and provide relevant and effective support. And we'll look at how we can formalize this arrangement in a more structured way so that they are more sustainable and also there's a continuity in the efforts. So we take your point and we'll explore other possibilities.
Mr. Leon Perera.
Thank you, Mr. Speaker, sir, and thank the Minister for his comprehensive statement. Just 3 questions. Firstly, just to confirm, I believe the Minister said that although this was not the protocol previously at the time, but right now it is the protocol that, where, as far as sensitive data is concerned, like personal data in the HIV register, right now, if a public officer exports or extracts or downloads the data, there is an automatic alert that is triggered, and then someone will see that list of download attempts and they'll be subject to some scrutiny. So I just wanted to confirm that is in place right now. Secondly, I think the Minister explained that the individuals such as Dr. Le, who had access to personalized information from the HIV register, needed that information in order to do their work like contact tracing and so on and so forth. In hindsight, I just wanted to ask the Minister, does the Minister feel that there could be more scope going forward to maybe reduce the number of people who have access to the personalized data to the absolute minimum and possibly even break up access to the entire database between different individuals so that very few or perhaps even no individual has access to all the personalized data, even though other individuals may have access to the aggregated data for the purpose of policy analysis? That's my second question. My third and last question is just based on what I heard from the Minister's timeline, and I'll stand corrected if I misheard this. The Minister mentioned that Brochez was convicted for a sentence of 28 months in jail in March 2017, and he was released in 2018. So I just wanted to check if he did in fact serve the full sentence as per conviction, or the sentence was reduced in length, or was it because he had already served time when the conviction took place? Thank you.
I think on the last question I can confirm with my colleagues, but I would imagine that it is subject to the normal prison terms where you have a remission of a certain period and then he was deported thereafter. So perhaps my colleagues can confirm. Your question about access. In fact, access to the data has always been on a need-to-know and need-to-use basis, and the number of staff in the NPH actually is very small. They are limited to a handful of people, and whenever they need the information, they will have to then access, because they are all doing contact tracing, doing analysis, so all of them are actually working on the similar type of matters. And at the same time, you also would understand that Le was the head of the unit. So in his particular position, he needs to have oversight of all the work that his staff is working, and therefore he would have access to all the information in any case. So I think it probably doesn't relate to this particular incident. And the new system that we put in place that has an audit trail, and this audit trail was not meant to watch everybody what it does. There are certain alerts that are built into the system where if there are excessive access to the information, or where there is unusual kind of access to information, it will be flagged up. And the audit trail will also allow us, when something does happen, to look back. And therefore, I think the overall system, let me just put in perspective, we are actually have to take a multi-pronged approach to data security. The first level is to have system in place to prevent abuse of data. things like encrypted thumb drives and this and that. So those are important, allow us to prevent attempts to abuse the data or illegal access to the data. The second level is for us to detect should something happen and there's some suspicious activities that's ongoing, and these are the audit trails that are important, documentation that's important. And the third level, which is equally important, and that is deterrent. And that is why if we were to find someone who have made illegal access or who have abused the information, who have been less than careful with the information that he's entrusted with, then we must take stern action. And that is what happened to Le and Brochez. That's why they were charged in court. And only when we do these three will we be able to have a robust system of protecting our information. So if you bear in mind that Le himself is the head of the unit, the safeguards that you put in place, even if it's effective, he has the right to access. Even if you have audit trails, most of the things that he does from our audit over the last few years when we check what he did, investigate, based on our investigation, they were legitimate work that he was doing with Ministry of Health. Whether or not he was careful in protecting the data that he was using is a separate issue. So many of these may not be able to stop Le from doing what he did, but the deterrent is an important part to make sure that those who want to try have to be mindful of the penalties that could be imposed on him if he were ever caught. And therefore, these three must work hand in hand to ensure we have a robust system of data security, protection, detection, and deterrent.
Ms. Tin Pei Ling.
Thank you, Minister. This is a very unfortunate incident. Got two questions. One is, may I know what is the risk of potential suicides among the affected individuals and what MOH may be doing to provide more support to help them tide over this very difficult period. Second is that I think quite clearly from the whole sequence of events, these two individuals, Brochez and Le, lack conscience. They are recalcitrant, spiteful, committed very despicable acts. And as you've mentioned also, despite having systems in place, policies in place, it did not stop Le from abusing his position, his authority, did not stop Brochez even, with different time milestones after being discovered, did not stop him from being willful and spiteful. So I'm wondering whether the current penalties are deemed to be deterrent enough and whether there is scope to enhance the penalties further to prevent such individuals from ever committing such crimes ever again. Thank you.
So, 2 points. First, on the risk of suicidal tendency. I get feedback from my medical social workers who are working on this, on the calling the patients. And they do tell me that in their calls, there were patients who were suicidal, and they have to manage the case very delicately, and they have to sense the distress the patients are facing, and they have to make a judgment how much to tell them, how much to stress them further, or to refer them to help. And often when they come across persons with a clear or intention to do something drastic, they will refer them to sometimes the IMH who can manage them. But very often they will try to refer them to people whom they are familiar with, people who has been their support group, so that they are able to continue to support him. But these are very delicate issues, and I don't want to go into specific details for various reasons. And on the issue of, what's your second question?
Penalties.
Whether the penalties are deterrent.
This is something probably for Ministry of Law to look into, but I think we will press for whatever is allowable under the law. But because I think the case is still being appealed, Le's case is still being appealed, I would not want to go into the case-specific details. as you know, we will wait for the court, the law to take its process.
Ms. Llewellyn.
Thank you, Speaker. I've got two clarifications actually for MCI, so I'm not sure whether Minister Iswaran or SMS Janil will take them. The first clarification is that in this recent incident involving the NPHU, that the organization concerned is actually within the Ministry of Health, and therefore I'd like a confirmation that they do not come under the auspices of the Personal Data Protection Act. That's the first clarification. Second clarification is, I think earlier SMS Janil went through the instruction manual or some policy about how the public sector safeguards personal data, and if I heard him correctly, a lot of responsibility is placed on the department concerned to assess and to come up with measures. So my question is, in this recent incident involving the HIV leak, did any department outside MOH assess whether the arrangements that were in existence at the time when the breach occurred, whether the security arrangements were reasonable? Did anybody outside MOH come to any conclusion or inquire into the matter?
Mr. Speaker, for the first point, Ms. Lim is correct. PDPA doesn't apply. For the second point, the answer is yes. The arrangements that the MOH team and the officers were involved in at the time were in compliance, were audited to be in compliance with the standards that were set. Those are not the same standards that are present today. And both the standards have changed, the training of officers has changed, and the deployment and use of technology has changed.
Ms. Abington.
Thank you, Mr. Speaker. On Mr. Leon Perera's point earlier on the sentence, just like to clarify that it was backdated to the time he was first remanded, which was June 2016. And thereafter, he also had the usual remission, which accounted for the dates that you had in mind.
Mr. Seah Kian Peng.
Thank you, Mr. Speaker. Just two supplementary questions for the Minister for Health. I'm heartened by the additional measures that Minister has shared, one of which he mentioned was the setting up a compliance team. I believe it was last year. I want to ask him, I want to have a sensing of how big this team is, this compliance team is. My second question is, on the one part we talk about deterrent measures. On the other part, I wonder whether for positions within the ministry which we consider as in possession of sensitive information, whether we could improve in the way we, prior to the appointment of people to these positions, whether we could subject them to additional tests, character, things which can allow us to sharpen the process of appointing these people to these positions. I recognize there are no foolproof systems, but for these positions I would request, perhaps it's already in existence, but I request that perhaps these appointments be subjected to more tests prior to confirmation of the appointment.
As I mentioned, the data governance group, we are now expanding it. I think we will need to look at the scope of the work and determine what's the size that we do. Currently, it is a very small unit and is focusing on dealing with the policies, dealing with practices, and reviewing the government MOH governance practices on data security. But in order for them to do the audit function, to go down to the ground, to look at practices, to enforce practices, we will need to significantly enhance the resources. And this will include visiting and checking on the operations on the ground, practice on the ground to ensure compliance. The policy is as good as how much it is practiced on the ground, and therefore it's important for us to make sure that they practice what the policy requires. So I think we will have to continue to enhance the size of the group. On the recruitment for staff handling sensitive information, we will take a look, but there's no foolproof system because the integrity of the person has to be tested over time. the Chinese says, 路遥知马力，日久见人心. So sometimes you do the best you can in assessing a person's character, but you will never know at the end of the day until you have worked with him over a period of time. And also, we also have to be careful with unnecessary discrimination when you deal with a character assessment. So some of these may not be objective. So therefore, it's in recruitment, in selecting people, we will need to take quite a holistic approach and to make a holistic assessment of the suitability of the person.
Mr. Png Eng Huat.
Thank you, sir. Just got two questions to ask the Minister. It was reported in the MOH website that Le has been charged under the OSA for failing to take reasonable care of confidential information regarding a HIV positive patient. So the critical issue here is not really about failing to take care of the reasonable care of the confidential information, but the issue here is why did the MOH system at the MPHU allow someone to download the entire database? You can access the database, but why allow someone to download the entire database onto a thumb drive to begin with? And then I seek confirmation then from the Minister that there was actually no safeguard against such downloading of entire database by authorized staff prior to 2016. Okay, and then the second issue is I also read from MOH website that additional safeguard against mishandling of information by authorized staff were only put in place 3 to 4 years after MOH was first alerted to an allegation that Le has misused the HIV registry. So, and I also understand earlier from the Minister Iswaran that there are regular mandated IT audit done. So, with regards to security of personal data at our public agency. So, why did it take so long for MOH to implement the additional safeguards? Because authorized staff still can access and download the entire database, like what Le did from 2013 to 2016 before the additional measure were put in.
Let me first respond to Mr. Seah's question. The data defense group, we have about 50, but the number who is looking at the governance division, we have about 6. So we will need to expand the governance division. On Mr. Peng's question, even in 2016, even in 2012, there were data security governance policies at that time stipulated by the government through the instruction manuals, IMs, and so on, and MPHU is compliant with the requirement stipulated in the government's data governance policies. For example, even at that time, you were only allowed to download data onto government-issued computers. And therefore, you are not allowed to download data into your own computers. You can only download data into your own computers, and you are allowed to have storage devices, portable storage devices at that time, because the encrypted storage devices was only a requirement in 2017 as a whole of government, not the MOH policies, but it's a whole of government policies. And therefore, we were in compliance, and it is the nature of Le's job requires him to constantly operate on the database, and therefore he's allowed to download the register into his computer. But unfortunately, he did not protect the data by using an unencrypted. At the time, you don't have encrypted thumb drive, so he used a normal thumb drive, and he did not protect the thumb drive. And if you are using the thumb drive, you need to transfer files from computer to another government computer to work on it. You ought to protect the thumb drive. And the policy stipulates that you must ensure that your access to the confidential information, official information, must be with you all the time. You must ensure that you have possession of the information all the time. But he was believed to have failed to keep the thumb drive with him at all times, and therefore that contravenes the OSA. and that's why he's charged on that basis.
Ms. Irene Quay.
Thank you, Minister. Can I ask Minister, with PDPA exemption for MOH, what will be the recourse for victims that the victims can seek as a result of this exposure of sensitive information? This is to address public trust for better accountability.
Patients can take a civil action against the Ministry of Health on breach of data or loss of data, but we encourage them to talk to us, and we will discuss with them what are the ways to help them and to support them in whichever way we can.
Mr. Dennis Tan.
Thank you, Mr. Speaker. My question relates to what I understand was the blood test that was done at Dr. Le's, at the clinic where Dr. Le was a locum. The Brochez did the blood test at the clinic where Dr. Le was a locum. So I'd like to ask the Minister, what are the rules preventing doctors from carrying out tests for people they know, which may put them in a position of compromise or conflicts of conflicts of interest, or questions of independence may be raised, exactly in the situation like when Brochez went to take a blood test at the clinic where Dr. Le worked in. Thank you. Sorry, just to supplement this, and whether or not the Minister thinks that we need to strengthen the governance in this particular area. Thank you.
I will need to be careful in answering this because the case is still, the appeal is still in progress, but I can answer probably generally. Generally, I think doctors have to exercise discretion, and they will have to exercise judgment too, under the ethical codes and ethical conducts, guidelines and ethical codes. They will have to assess whether they do have a conflict of interest, and if they feel that they have a conflict, they ought to make it known to the patient and to then step away from whatever procedure or treatment that you may be offering to them. But we cannot have a rule to say that you are not allowed to see everybody you know. Then you have a problem, because doctors know many people, and therefore I think eventually it's a judgment of the doctor himself to assess that whether by treating you I do have a conflict of interest. But I must say that in this particular case, it's not the conflict of interest, it's more than that. Yeah, and Brochez has been charged for cheating for fraud for specific reasons. So it's not just a conflict of interest. In Brochez's case, which the case is over, it was a fraud.
Dr. Lim Wee Kiat.
I'd like to ask the Minister that the Minister mentioned that out of the 2,500 that you have contacted, has any of them been contacted and being blackmailed? And was there any demand made on them in the first place? And you mentioned that there were a few of them that was given the link. You know, when they were given the link, what was the demand? Under what circumstances? Why were they given the link?
Part of this is part of the police investigation that's ongoing. But I must, maybe I can just say that Brochez is not very consistent in his communication with all the relevant parties. So it is very difficult to fathom what is his motive in sending these letters or demands. So far, we have not received any complaints or feedback on blackmails or threats from our patients or from any of our contacts. So I think I probably should not go too much into the mechanism and the process because this is part of the police investigation work that's ongoing.
Associate Professor Walter Theseira.
Mr. Speaker, thank you. This is a question about government disclosure policy. I agree that in this case, the government had to make a very difficult decision to balance transparency with the interests of those affected, and I do not want to second-guess that decision. But I fear that without a general government policy on the issue, the government will find it difficult to effectively rebut claims or conspiracy theories about government lack of transparency. So I would like to ask the government if it would find elucidating, developing a general policy on disclosure useful to enhance transparency and enhance public trust in the government. Thank you.
Sir, I'm afraid these issues tend to vary from issue to issue, from case to case. As much as I would like to have a standard rule and say, this is not my problem, I just follow the rules. Okay.
Mr. Speaker, I thank Professor Theseira for the question. There are general guidelines for the handling of data, the training of officers, the protocols that should be in place across the public sector, including what are the considerations that should be taken into account after an incident occurs with respect to the affected individuals, the processes of the agency, and the broader public. So it's not that there are no guidelines, that there are no, it is not a vacuum. There is quite a lot of thought, consideration, and processes that are in place. But there is no single general rule simply because of the complexities of the situations as we've described today. And as you've heard from the difficulties in making the judgment call in this incident, you can imagine that it would be very, very difficult to come up with some general rule which would ultimately get the right balance between the privacy of the individual and the public interest. And we do want to strike that right balance. The other aspect to consider is that within the public sector, there are a number of other entities, Smart Nation Digital Government Group, GovTech, and also the security services, the police, where these matters can be reported to, and an external view given by people who are not directly involved in the incident.
Order. End of ministerial statement. I propose to take a break now. I'll suspend the sitting and we'll take the chair at 4 p.m. Order. Order.